During the month of June, the Heart Foundation and Women's Health Queensland-wide are working together to highlight women and heart disease. Heart disease in women is often described as under-recognised, under-treated and under-researched. This is why the Heart Foundation aims to make heart disease in women visible to all Australians. During this presentation, we'll be talking about what you know about heart disease in women, the key facts about women and heart disease, and how the Heart Foundation is responding to this issue. We believe there is an urgent need to make the issue of heart disease in women more visible. We need to challenge the stereotypes that heart disease only affects men. We need to start the discussion of why this is an important women's health issue, and we want to empower women in the steps they can take to lower their risk. Making the invisible visible is the Heart Foundation's new Women and Heart Disease campaign. It's a call to action for all women and men to take heart disease in women more seriously. Making the invisible visible is a platform to inform, educate and raise funds. What do you already know about women and heart disease? Here are 3 quick questions. True or false, heart disease is the single biggest killer of Australian women? That's true, and we will discuss each of these in more detail later. Secondly, true or false, women only have to worry about heart disease once they reach menopause? And that's false. And finally, most women are aware that heart disease is a significant women's health issue, and that is also false. So let's have a look at the key facts. Heart disease is the #1 killer of women in Australia. It kills more than 3 times as many women as breast cancer does. Heart disease claims 24 female lives every day here in Australia. For 60% of women with heart disease, their first and only sign is a sudden heart attack. 90% of women have at least 1 risk factor for heart disease, and 50% have 2 or 3. Awareness and knowledge of the risk factors and warning signs is extremely low in the community, with less than 4 in 10 women aware of these facts. Now we'll talk about the risk factors, the importance of a heart health check, issues that affect younger women, knowing the warning signs, and actions you can take. So there are some risk factors we cannot change, and that is that we are all getting older. So increasing age is a risk factor for heart disease. Also, having a family history of heart disease places you at increased risk. And also, women are at the same risk as men once they reach menopause. There are also risk factors which we can change, and what we do know is that heart disease is mostly preventable. So it's very important that we get to know what are those risks that we can change in our own lives to prevent heart disease and heart attacks in the first place. And some of those risk factors include smoking, and that includes passive smoking, being physically inactive, not doing at least 30 minutes of moderate intensity physical activity on all days of the week, being overweight and obese, harmful use of alcohol, which is more than 2 standard drinks every day, or binge drinking. And you may not be aware, but depression, social isolation, and a lack of social support place you at increased risk. There are other risk factors as well, including high cholesterol levels, poorly controlled diabetes, and reducing high blood pressure. And these are things that we can change, but we won't know what our levels are unless we go and see a GP and get tested for these. Just a little word about overweight and obesity. What we're trying to encourage people to do is lose that weight that is around their tummies, that places them at increased risk. And we would say that people are at increased risk if they have a waist measurement of over 94 centimetres for men and over 80 centimetres for women. This is why it's very important to talk to your GP or your health provider about all of these risk factors, and talk to your health provider about your family history, have your blood pressure checked, and have your cholesterol tested. Just a quick word on heart health in young women. For women aged 18 to 44, approximately 425,000 have high blood pressure and 900,000 have high cholesterol. And as we already know, these are risk factors for heart disease. Close to 1 million are obese and more than 1 million are overweight. Pregnancy is often called the ultimate stress test for the heart, as it increases the load on the heart by 30 to 50%. Women with pre-existing heart conditions or those with risk factors like high blood pressure or obesity should have their heart health monitored throughout pregnancy and in the years following it. We're learning more and more about the impact of conditions such as preeclampsia and gestational diabetes and their long-term effects on heart health. Finally, let's talk about the important actions you can take today. Have a heart health check. Knowing your risk is the first step to helping avoid heart disease. Don't wait for chest pain, it could be too late. Get the vital tests you need by visiting your doctor for a heart health check. And know your numbers. Find out what is your cholesterol, what's your blood pressure, what are your blood sugars, and what's your waist circumference. Know the warning signs of a heart attack. Heart attacks are not always what you think. The sooner you dial 000 for an ambulance, the sooner treatment starts. Generally, women have fewer heart attacks than men, but when they do, their outcomes are often worse, especially among younger women. The warning signs of heart attack include neck, shoulder, arm, jaw and back pain and central chest pain. But what research has found is that more than 40% of women will not experience that central chest pain. So knowing the warning signs could save your life. At the Heart Foundation, we would encourage you to share this message with at least 3 women you know to make the invisible visible. Listen to women's stories, and there are a number of different women's stories on the Heart Foundation website and at invisiblevisible.com.au, because every woman's journey is different. And you have some opportunities yourself for involvement. You can align with the Heart Foundation as a key sponsor or supporter of the campaign, personally share our messages online through social media. You can financially support the campaign, reach out to your networks, volunteer to help us spread the word, and mostly visit our website at www.invisiblevisible.com.au. Get involved and make a difference.